So our first session is the National Mission to Reduce Drug Deaths, and I'm delighted that Constance, MSP, the Minister for Drugs Policy, is here to open this important conference. Now, I said to you that until recently I was chair of the Scottish Drug Deaths Task Force, and in my initial meeting with the Minister, she said to me, "We want you to produce recommendations that are bold and radical." Now, the Changing Lives report, which we published at the end of last month, I think has bold and radical recommendations. Some people have said that to us. It's very comprehensive. Others perhaps inevitably think that we've not been radical enough, and you might be in one of those camps or somewhere in between. I think what's important for all of us now is that the recommendations from that report are implemented. What we say very clearly, and I'm sure you will all echo this, that now is the time for change. And so I'm delighted to invite Constance, MSP, the Minister for Drugs Policy, to come and address us. Thanks.
Thank you very much, David, and good morning to everybody here today. I want to start by thanking the Scottish Drugs Forum for hosting this conference and for giving me the opportunity to spend some time with you all and to say a few words, particularly today, because today we come together to mark International Overdose Awareness Day. Since 2001, when International Overdose Awareness Day was first initiated in Melbourne, many communities across the world have held events to raise awareness and commemorate those who have been lost to drug overdose. And this is the world's largest annual campaign to raise awareness about the tragic loss of life to drugs overdose, and it provides an opportunity to remember those who have died and acknowledge the grief of families and friends left behind. And I, as I always do, offer my sincere condolences to everyone who has lost a loved one. And like everyone else here today, I also offer my continued commitment and increased resolve to do more to save and improve lives. So today is time to stop and reflect on what we have done thus far, but also on what remains to be done, what must be done to stop these preventable deaths, what has worked, what hasn't, and what must change. And today's event will stimulate important discussions, perhaps even in debates that I'm sure will be dynamic as opposed to divisive, debates and discussions about evidence-based overdose prevention, harm reduction, and wider drug policy approaches that will help us tackle head-on this drug deaths crisis that we face here in Scotland. Today will be important in increasing our understanding of how together we can drive that change, both in policy and in practice, to deliver our national mission to reduce drug deaths. Our national mission is focused on a public health approach to a public health emergency. It's a step forward because it seeks to link crucial evidence-based drug treatment and recovery and essential services with the needs of people impacted by drugs. We are now in the mission's second year. We have laid important foundations for change. And with the additional £250 million over the lifetime of this Parliament, our focus is on ensuring the successful delivery and implementation of services on the ground where it matters the most in our communities. And treatment is at the very heart of our mission. To improve access to prevention, treatment and recovery services is to support people at all stages of their journey. And we have seen significant change in the way some services are delivered, but more is to be done with the embedding of medication-assisted treatment standards, for example. And these standards are human rights and trauma-informed and will ensure consistent delivery of safe, accessible and high-quality treatment. And we are determined to see our services offer same-day treatment a wider range of treatment and recovery options with informed choice and families included practice, and more assertive outreach and support for people to get into treatment wherever they are, to bring them into the protection of treatment and to make recovery a real option. One of the significant components of the national mission is to improve the accessibility and capacity of residential rehabilitation and that essential aftercare. The government has committed £100 million of national mission funds to support people who want to pursue abstinence-based residential rehab and for whom it is considered appropriate. And this work includes developing pathways, standards, increasing capacity and developing a more standardised approach to commissioning residential rehab services, amongst other things. And we are making progress with developing services for women and for families. As part of our mission, we are working for those better links with other parts of government to tackle other problems associated with drugs. Drugs policy and practice mustn't be seen in isolation from reforms to the criminal justice system, from our work to address poverty and inequality. And we must work with partners in mental health, homelessness, primary care and social care to ensure that there is no wrong door for people to get the treatment and the care that they need. And the Scottish Government must practice what it preaches in terms of getting people out of silos. And in all of this, our partners in the voluntary sector and their unique contribution mustn't be forgotten or overlooked. And these cross-government efforts align with the recommendations made in the final report from the Drugs Death Task Force. The report is critical, it's challenging, and it's constructive in equal measure. And it does give a blueprint for the future. And I will, of course, respond in full to Parliament with respect to the government's response. And you will hear more on the recommendations from Fiona McQueen later today. But I would like to take this opportunity to thank both the Chair David and the Vice Chair Fiona, along with all members of the task force, past and present, for their commitment to producing these recommendations. One point which came through strongly from that report, and which I've heard numerous times since taking this post, is that stigma kills. Stigma is a barrier to treatment and help, and we know that stigma stops people accessing help, which is why we are taking forward the Task Force Stigma Strategy. We are working on a charter that will encourage organisations to consider best practices to create a stigma-free Scotland. And I have heard repeatedly how stigma and problem drug use can cause hardship to families and loved ones. To provide additional support to these groups, I published a framework in December which sets out how we will improve holistic support for families. And that has been supported by an additional £3.5 million for alcohol and drug partnerships and £3 million to support vital frontline and third sector services. And we will continue to work with local areas to implement that framework in all parts of Scotland. This year's theme of International Overdose Awareness Day is the role of people with living or lived experience in developing policy and practice to reduce drug deaths. And we endeavour to fully understand, to really listen and to really learn and to respect the important contributions that people with experience make and the insight that they bring. And that's why we are setting up the National Collaborative for Lived and Living Experience, chaired by Professor Alan Miller, who will also be speaking to you later on today. The collaborative is bringing forward its vision for integrating human rights into national policy and local service design and delivery. And that will be based on internationally recognised human rights, as will be included in our forthcoming Human Rights Bill. And the collaborative will hold us all to account and ensure that people with experience can participate and shape and influence the decisions that affect them. It will also ask tough questions and demand clear answers. Of that, I have no doubt. And as David said earlier in his opening remarks, as well as having the courage to challenge, we also have to have the humility to be challenged. On this day last year, Scottish Government and the Scottish Drugs Forum launched a national How to Save a Life campaign. That campaign raised awareness of symptoms of overdose and naloxone medication that can reverse opioid overdose. We then saw a dramatic increase in the number of people accessing training and ordering naloxone kits. It is encouraging that people recognise the role that they can play in preventing deaths from overdose. The evaluation of the campaign led by Glasgow Caledonian University has been published today and is on the SDF website. This government remains fully committed to widening access to naloxone, whether through the fantastic click and deliver services offered by Scottish family affected by alcohol and drugs, from treatment services and pharmacies, or from emergency services. And today also marks the start of the national rollout of police carriage of naloxone. Police Scotland, we believe, is the first police force in the world to do so, and they should be commended for this, and this is an outstanding achievement. I also want to take the opportunity to thank the Scottish Ambulance Service for their pioneering work around non-fatal overdose pathways and for increasing the distribution of take-home naloxone. And I am very grateful to the Scottish Drugs Forum and in particular to Kirsten Horsburgh for the assistance that they have provided to expand the distribution of this life-saving medication. And I'm also really pleased that you will have the opportunity to hear from Sakit Peridashi about the work undertaken to set up a safer drug consumption facility in Glasgow. I have a commitment to leave no stone unturned to overcome the barriers to find a way to develop and deliver safe drug consumption facilities within Scotland within our existing powers. And a proposal has been developed and has been submitted to the Crown Office for consideration, and we await the decision from our independent Lord Advocate. We know that safe drug consumption facilities are not the single solution to drug deaths. Nothing is. But I do remain convinced that they are part of the solution because the evidence from 100 cities in 10 countries around the world tells us this. Friends, I will always defend and advocate people's right to choice and opportunity, whether that's to residential rehabilitation or to access abstinence-based programmes. But I will also be fearless about the need to be serious about harm reduction in Scotland. I have never been interested in debates that are about supporting residential rehab over harm reduction or debates about supporting harm reduction over abstinence. I am only interested in supporting people, our people. And what all effective life-saving, life improvement interventions and services have in common is they don't push people away, they try to reach them. They don't squeeze folk into a tick box. Instead, they accept people, they take people as they are, offer help that people need and want, and build relationships built on trust, compassion, kindness and respect. And for people commencing treatment or that recovery journey, there are huge expectations placed on them to take ownership, to take responsibility and to show commitment. Well, for those of us in positions of power, responsibility and influence, we also need to take ownership, responsibility and demonstrate our commitment and turn our words into action. And we also need to accept that it's not just others who need to change, that we need to change too. So that's what today's about. That's what you're about. That's what we're all about together. Thank you.